Now we are going to do the standing hip hinge weighted. This is a progression from the standing hip hinge that we have done with just the band. We're going to still use the band assist if you feel like you need to, and when we are ready, we're going to progress you to without the band. Now, if I've given you specific instructions, then you're going to notice that I'm going to put one foot in the band instead of both feet in the band. When we have a specific limitation, especially in rotation, and I'm going to try to do it on this side, so I'm blocking my hip from rotating here instead of rotating all the way around. We need extension in that hip. So what we're going to do is we're going to put the band on one leg so that it can help that movement pattern. I know that on my left-hand side, I have better control over this. So I'm going to use my right side as an example today. So I've got this kind of sitting just at the top of my leg here. Just make sure it's comfortable. It doesn't matter like if it's in the hip crease or if it's just right here. Okay. So what I'm going to do is I'm going to walk out with it and get enough tension on the band to where it's almost pulling me backwards. Now with this exercise, we can have the weight in the front, or you can hold it in a front rack position. I like the front rack position a little bit. It's a little bit harder here. So what we're going to do is take a deep breath in, shoulder width stance with the feet, slight bend in the knees as we hinge down, and then come back up. I'm going to demonstrate it with the weight in front. I go down into the deadlift, and then come back up. Notice that my eyes are following the horizon. So you see me looking down, keeping my neck in line with my back, in line with my hips as I go through this movement. Now, I want to mention something here. Putting this on my affected side, I'm noticing some tightness in this area in my core and in my hip flexor. I want to point that out because it's not a bad thing. It's actually pointing out the asymmetry and some of the issue that I have with specific movement. Everyone that's watching this video is going to feel it differently in different places. I feel different in my core. I feel it just a slight bit, not pain or anything, but just a little tightness in my back on that side, which is a good thing because I know that I need strengthening on this side of my hip. So feeling those different things is not a bad thing. The more that we lean into that perceived threat and we know that it's okay, the more that our pain is going to be decreased as we do specific motions. Think of it as a good thing because your body is adapting to the stimulus that we were putting in with the specific exercise tailored to you.